Well, welcome everybody. For folks who just came in, since the last time I announced it, there is a sign-in sheet here. If you need it, I will send it around. And just make sure that you do sign in before you leave today. I'll have it up here. We can leave it in the back after it goes around. I'm Alexis Glidewell. I'm the licensed clinical social worker in the geriatric medicine department at Kaiser. Many of you are familiar faces to me, so welcome back. Some of you are new faces. Welcome. We teach these classes each month in partnership with Redwood Caregiver Resource Center. Some of you are on their mailing list and you get notices quarterly about these classes. If you are not on their mailing list, I would really recommend getting on the mailing list. That way you'll be notified quarterly. It tells you what room we're in, what time the classes are offered, and the topics of the class. We are going to be talking today about managing caregiver stress, and we're going to spend quite a bit of time enumerating what caregiver stress is and what's so stressful about it. Because I think before we can get to a place where, I'm going to turn this, I hesitate to do that, but turn that off because it's shining in my eyes. Before we can get to a place where we can come up with some solutions or talk about why certain things are more helpful than other things, we kind of have to clarify the problem. So in my experience working with family caregivers, I worked at Redwood for 15 years before I came here to Kaiser, and I did lots of counseling, support groups. I've been teaching these classes for all of that time, almost 20 years now. In my experience, I think one of the most difficult areas of caregiving is that intersection where receiving care and giving care meet. And so I think it makes sense to look at what's so difficult about receiving care and what's so difficult about giving care, just so we can validate these challenges. Sometimes people would come to my office and say, well, I don't know why it's still so hard. I've been doing this for a long time now. You think it wouldn't be so hard anymore. And so I think it's helpful for us to take inventory. Why is it so hard? Is it because you're flawed? Is it because you're doing something wrong? Or is the nature of this very complicated and difficult to begin with? I think that's pretty much the crux of it. Now, there's always room to improve. There might be something that we're doing that is not helpful, and we might benefit from someone else coming alongside and saying, maybe try this strategy versus that strategy. And that can lighten the load. But I think the very nature of caring for someone who's dependent and has a chronic degenerative illness is that it's very, very complicated. There's so many layers, so many factors involved. So we're going to together, you're fine, we're going to together work on brainstorming what's so hard about caregiving and what's so hard about receiving care. And we'll kind of compare those two. And then from there, we'll talk about what might be helpful in the way of coping. The video that we're going to watch following that is kind of the same thing. It's a social worker from the Seattle area meeting with a room full of caregivers. This was made years ago. Wendy Lustbader, I love her. I've seen her talk all over the country. She's a great social worker working with older adults and caregivers of older adults. She wrote a great book called Counting on Kindness, which talks about how difficult it is to get through your day counting on the kindness of other people. So she kind of does the same thing with this room full of caregivers who have come to hear her talk. And the purpose of me showing that video is really to kind of validate that even in Seattle, a room full of caregivers are experiencing similar things. So as we watch the film together, be mindful of some of the things that might be echoing from the discussion that we have together. Anybody have any questions or anything you want to say before we jump in?
When you say the two things meet, are we looking at it from our side or their side?
We're going to look at it from both sides. Yeah.
Okay, say it again, and then that's you're going to do.
We're going to look at both sides, where what's so difficult about receiving care and what's so difficult about giving care.
For them to receive.
Okay. So I think what we'll do is start with brainstorming together what's so difficult about receiving care. Has anybody here ever been in a situation in their lives where they needed other people to help them get through the day after a surgery or an illness, an injury? So I see a lot of nodding heads. Think back to that time. Kind of put yourself back there and use that to inform our brainstorming right now. Also think about the person for whom you're providing care. What's so hard about being a care receiver?
Not being independent
So, loss of independence and increased dependence. I heard both.
our whole life we young. And that feels like a loss of power.
That feels like a loss of power. Why is this so charged? Why is that so hard? Why is independence so important?
You know, to be proud that you're able to do your part and fulfill your partner's needs and your own.
So I'm hearing a few things. So it kind of, when we're independent, we're proud that we're fulfilling our part. So I'm hearing that there might be some shame around being dependent. If we're not proud, the opposite might be a little bit of shame. I'm just going to say, you said your part, but I'm just going to say roles, because that I had enough room for that.
Fear.
Fear, yeah. Fear of what? I'm just going to do this. So it's scary to lose control. Why is it scary to lose control?
So we lived our own life in control of our own life, and then to lose that is then everything's gone, right? Yeah.
So losing control, we're used to having some sense of autonomy and power, and when we lose that power, it's kind of unfamiliar to us. So that unfamiliarity, it's a new role again.
Loss of self.
To make you mad.
Accept.
You guys are saying really good things. I want to stick here for just a second. So it's unfamiliar.
Vulnerability.
We're vulnerable. Increased vulnerability. So this is kind of the psychosocial part, the loss of and changes in our roles, what it means to us, why there's a charge around it, how we feel about it. When we don't have control, we feel really vulnerable. That's kind of like the title of the book I was talking about. Counting on kindness of other people to get through your day when you're at someone else's mercy to get through your day, you're in a pretty vulnerable position. What about other aspects of fear around receiving care? Fear of the unknown, yeah? Think about the person you're caring for. What kinds of things do they express fear around? They might not be able to articulate, I feel fearful, but what kinds of things do they act fearful around or resistant to? Sometimes that resistance, combativeness is coming from a vulnerability, self-protective sort of place.
My wife doesn't like to take the medicine, how come I have to take it?
Uh-huh.
Why are you making me take it?
Uh-huh.
That's what the doctor said.
So that's some loss of control and confusion, which also makes us feel out of control. Anybody caring for someone who has fear of falling? Fear of being hurt? Are you going to hurt me? And that's kind of that sometimes is related to medications. I've had people whose loved ones won't take the medication because they think you're trying to poison me. Or changing people or providing personal care, and they might feel attacked or violated because they're misinterpreting why you're doing these things unto them. Fear of falling, fear or fear of violation.
It can also be that it's, you feel like you haven't made the choice. This choice is being thrust on you. I mean, that's also powerlessness.
That's powerlessness
vulnerability.
and vulnerability, but
It's
I,
the emotion that comes
yeah,
from feeling that
so
I
there's
didn't
that
choose
lack
this.
of autonomy, right? Somebody else said loss of self. Whoever said that, can you elaborate on it? Or even if you weren't the person who said it. Any thoughts about?
That's fear. It all comes down to fear.
A lot of it comes down to fear, yeah.
Unknown.
But the loss of self, how are people losing their sense of self?
I think an example in our case, her aunt was, they called her the Energizer Bunny. She was always out dancing, doing all kinds of different things. And once she realized she had a memory issue, she quit all of that.
Mm.
So,
And also
embarrassment factor.
embarrassed that she can't remember how to cook, so someone else is cooking for her, but she thinks she can. So that is a big hurdle for her. The toileting is a big hurdle to have anybody in there to help her. And I think that's all that loss of self.
So there's loss of self in personality changes,
You don't recognize
in
yourself.
capabilities, right, you don't recognize yourself. Capabilities,
Nobody wants to be 6 again.
identity. And I think that a lot of this is for people who are aware of what's happening, but what I'm also hearing from you is some of that lack of awareness, right? She can't cook anymore, but she thinks she can, but she can't, so she has someone to help her, but she's not necessarily grateful for that lovely help, right? So there's lack of awareness for the need for help.
Could it be the opposite too? Where they really want help? They know they can't do it?
It can be,
Yeah.
yeah. So let's stay with this one for a minute and then we'll go to that one. If you don't have insight for your need for help and people are telling you, you have to let this person come in and help you, we have to do this for you, you can't drive anymore, you have to take this medicine, she has to be here with you, I have to help you in the bathroom, and you don't think you need help with those things. How does that feel?
Awful.
It feels awful.
Resentful.
I might feel resentful.
Angry.
I might feel angry, out of control. We haven't said anger. So more control, fear, anger. I think it sounds really scary. Who can I trust? If all of these people around me are telling me things that don't resonate with my experience, they might be lying to me. And if I don't have a yardstick for who's safe and what's safe anymore because I can't remember, then I have to really have my guard up. And to get through the day, I have to suspect everyone and everything until it feels safe. Not until it sounds good, not until they make a case for it and I understand. If I have a cognitive impairment, that's not going to happen until it feels safe. And that's where some of those adaptive communication and behavioral challenges that we've talked about in previous classes can come into play. When we understand this experience, it makes a lot more sense to employ some of those strategies, especially when we understand that the logical, reasonable explanation around why she needs someone, and I'm just using your example, why she needs someone in here to help cook is not only unhelpful, it's counterproductive. Because she doesn't need someone to help her cook, because she's been cooking her whole life, and she can cook just fine by herself in her own kitchen. Thank you very much. In 2 languages. So when we understand that it's not resistance or stubbornness, even for someone, especially for someone for whom resistance and stubbornness has been a characteristic personality trait. When we understand it's more accurately described as a lack of awareness for the need for help, then it's easier for us to give ourselves permission to use those adaptive strategies like speaking to the emotions rather than the words, giving ourselves permission to alter the truth a little bit. Things that sound horribly disrespectful outside of this context and would be horribly disrespectful outside of this context, but that are indicated, accommodating, and respectful of the new need. I'm kind of jumping the gun because some of that permission to adapt is part of how we manage the stress. How we interpret difficult behaviors. The meaning we assign to the behavior and our response to it are the only things we have within our control. And if we interpret someone else's behavior one way, we're going to have a corresponding response to it. And if we interpret it a different way, we're going to have a different response corresponding to that interpretation. And so it's really important that we make sure that we're assigning meaning to behavior that's more accurate in the context within which we're working now, which is this stinking disease process that we wish we weren't in. So the lack of awareness is huge. You mentioned sometimes the opposite happens.
Yeah.
People feel more dependent.
Yeah, and
Peop-
like it.
Mhm.
And like it. Say, they say they don't, but they do, I know.
So that's a change in personality as well.
Oh, yeah, because he was very,
So feeling feeling like they need more help than maybe necessarily they do. And that's probably also, as you said before, it's all kind of based in fear. I can't trust myself to be able to do this because I can't even remember what I can do. These things I used to do that didn't throw me for a loop were familiar, and now they're not familiar. You know, in the one of the previous classes on communication and behavior, we talk about how much predictability and familiarity play into informing our sense of safety and security. They use disorientation to torture people. So if I can't predict what might happen to me in this circumstance, even though it's something I used to be able to do and I did often, but if I forgot that and I can't predict what might happen to me, then it's scary. I can't come up with a plan. It's no longer familiar or predictable. It's not scary for me to go to the ladies' room because I know what I might encounter on the way. I know what I'll see. I know what I might or might not see. So, you know, if people walk by me in the hallway, that's not going to be alarming. And if nobody walks by me in the hallway, that's not going to be alarming because I'm familiar with both scenarios. I know the sounds I'm going to hear. I know what I'm going to see along the way. I know what it's going to sound like when I go in. There might be people washing hands, toilets flushing. I know exactly. I can picture in my mind every step along the way to that ladies' room around the corner, and I know what it looks like and sounds like when I go in. I know what it sounds like if I'm by myself in there, and I know what it sounds like when there are people in there chatting with their heels clunking on the floor. So it's not scary. But if I couldn't remember those things, everything's scary. And so one of the ways that I manage that fear is to make sure you're always here like a security blanket. Yeah. What else?
I think the quote that resonates the most with me is, "This is not how I wanted to live my life." That moment of awareness that she had.
Yeah, I call it cruel awareness. There's so much in that early moderate stage that's so cruel. You know, we think mild, we hear early, oh, at least they have some insight. And we think that means it must be easier. But I think, you know, I used to facilitate an early stage support group for 5 years. And what I learned doing that group is that this is the stage of shock and awe. This is the stage where people are just capable enough to get things really tangled up and not aware enough to untangle and not aware enough to welcome help untangling. It's like a minefield. And it's really cruel when the person has that awareness. I always remind family members their awareness exists when it exists, and it doesn't when it doesn't. Your awareness is always there, so be really gentle with yourselves. The same compassion you have for them when they have those fleeting moments of awareness, have for yourself all the time. What else is so difficult about receiving care? I think about when I had a C-section. I couldn't even take a shower without my husband helping me. And then when he was helping me, I felt like I told him, I feel like I'm an elephant being hosed down at the zoo. I remember another time with my third pregnancy, I was on bed rest for 7 of the 9 months. So my husband, we had a 4-year-old at the time, and my husband would have to get me snacks and water and put it all next to my bed. I was lucky enough that I was in a job at that time where I could work from home. I did a lot of telephone consultations, and I could write reports from my bed, so at least I wasn't totally losing my mind. There's only so many movies you can watch. But you know, my husband would get our 4-year-old ready for preschool, bring him to preschool, go to work, come back. He did all the meals. He got my stuff prepped for me. And I remember one day they were out in the living room, and I could hear them playing. And I called from the bedroom, "Can I have some water, please?" No response. "Hey, I'm thirsty. Can I have some water, please?" "I'm really thirsty. Can I please have some water? It's not bad enough that I'm stuck in this bed. Don't you think I would get water for myself if I could? Do you think I want to have someone have to bring me water? Could you please just bring me some water?" And my husband brings me some water, hands it to me. He says, "Sorry, I'm trying to wrangle the little guy. And I took the glass from him and I said, ice?
No good deed goes unpunished.
How long have we been together? You know I have sensitive teeth. My mother used to joke and say, I think your husband's going to need a caregiver support group after putting up with you. Not my proudest moment, but you know, there I was. I was counting on him for everything, and I didn't like it. And then I had enough awareness. I knew this was temporary. I knew it was for a good reason. I knew that he was doing the best he could do, and I was so grateful. And I was so grateful that he was such a good, adept father, and I didn't have to worry about our son having any adjustment issues. And I still bit his head off. How much more so if I didn't appreciate the help because I didn't think I needed it? How much more so if I perceived his help as invasive rather than helpful and kind? Anything else anyone can think of about what's so difficult about receiving care?
I just come to the point of looking at all this and feeling the gut level feeling. So it's a feeling.
Mhm.
It's not even, it's not logical. It's
Right,
a feeling
right.
of being less than, a feeling as somebody so frustrated.
Yeah, you're exactly right. She's saying she's understanding that this is more a gut level feeling, all of this, than it is an understanding. People with dementia are operating from instinct, intuition, and emotion. They're not operating from intellectual capacity or logic or reasoning. They're not linking together episodes throughout the day to come to a conclusion about why they feel how they feel now. We are. This is more instinctive and intuitive. We enumerated all the fear. I'd like to go back to shame. You think I'm a glutton for punishment, but why is it shameful? Why is it shameful? We said loss of independence, increased sense of dependence, loss of power, and then the next thing we talked about was a sense of this hurting our pride, this sense of this being shameful. Why?
Ego?
Our ego, yeah. I mean, our ego wants us to believe that we're capable. Mm-hmm.
You've also been taught, perhaps, this is the way you're supposed to be.
Mm-hmm. Yeah.
Well, there's social norms.
Yep.
You know, someone makes dinner for you, you invite them for dinner later, and certainly in the generation we are now dealing with, that's the world they come from. Someone does something nice for you, you do something nice back. And they no longer have that ability.
So these are all tied together, right? We're taught our social norms, and they affect how we perceive ourselves. So our society puts a premium on independence. We're supposed to pull ourselves up by our bootstraps. We're not supposed to be a burden.
We're expected to be productive.
Yes. We're expected to be productive. We're not supposed to be a burden on anyone. We're not feeling purposeful or productive. I know you can't read it, but just a visual for how much is up here.
Just what society thinks. I think that, and probably for that reason, we feel that way.
Mm-hmm.
We feel ashamed because we're burdened. We feel ashamed because we're not producing.
Mm-hmm. We do, and I think it's because of that interplay. You know, none of us exists in a vacuum. We're all in this interconnected social situation that informs why not being a burden is so valuable. When you ask people what their biggest fear about growing older is, most people don't say death, illness, pain as number one. They're up there. What do you think number one is?
Loss of independence.
I don't want to be a burden on the people I love. And loss of independence is also up there. I don't want to be a burden on my loved ones.
Guilt.
There's guilt, yeah. So the guilt and shame are often, so guilt, anger, shame, fear. So when we live in a society that tells us our value comes from our ability to be productive, we need to contribute, or we don't have worth, then when we are not able to do, we're not capable of doing the things we used to do to contribute, what's our worth? What's our purpose? And if I'm not purposeful, what's my value? If my value is only placed on my ability to produce. Now, we sit in this room and we understand this and we also chuckle at it because it's silly. Independence is really kind of a myth. None of us is independent. We're interdependent. But we have a premium on independence, as if we ever were independent. Now, there's a spectrum, right? How much dependence we have and what we're dependent on others for. We could spend the whole 2 hours just talking about that. What is it okay to get help for and what is it not okay to get help for? When is it okay to ask for help? When is it not okay to ask for help? When is it burdensome and when is it not burdensome? As if we had choice around getting diseases or illnesses or injuries. So we could go on and on and on forever. If anyone sees anything glaringly missing from this, please speak now or forever hold your peace. The purpose here is to illustrate how complicated it is to be the recipient of care, whether you understand your need or not. The challenges are different depending on whether you understand the need or not, but challenges nonetheless. So let's transition on to what's so difficult about giving care. You guys are experts in this.
A lot of the things that are on the page show up right
You're my star pupil.
I'm looking at, well, I got all those ones from previous years.
Good, I'm hoping you're drawing those conclusions. A lot of it is parallel, huh? Yeah. So somebody said loss of independence. I think, and I'll write it down, but I think if we kind of finessed it a little bit, is it more accurately loss of freedom? So we can still independently do things. We're still capable and functional. We just can't, we don't have time for it. We don't have respite. We don't have money. It's cost too much.
I always term it as, I'd like to have my own life back.
Yeah. So I am going to go back here. I know I said we had to forever hold our peace, but there's one thing on here that's, for me now, glaringly missing. I'm hearing someone talk about grief here, and it's here too. Even if, as you said, even if they're not aware of it at this intellectual level, the feeling of grief. We've said loss how many times on that sheet? So, all right, you know me. We could probably add more, but what's this grief about? Somebody said my old life.
My future.
My future. So this is kind of some anticipatory grief, huh?
even if they're there.
Mm-hmm.
I miss
So-
my husband as I cared for him.
Yes. Okay, I'm going to catch up here because I want to get all of this on here. My future, my loved one. Missing the care receiver as we care for them. So there's a grief associated with the loss, the presence of loss, and then there's that missing, that longing, which is kind of under the umbrella of grief, but a little bit nuanced and different. I miss it. It's different now.
Conversation, being able to get feedback.
Uh-huh, uh-huh. So it can feel, I'm going to say there are changes in roles and relationships. And that's with the care receiver, with other family members, professionally. How many people have to quit their jobs to care for people or take an early retirement or lose all their family medical leave and lose their job?
Alexis, on the other page, when you were
Uh-huh.
talking about interdependence, it made me think of the loss of that interdependent relationship. Another person isn't able to
Yeah.
carry their weight. And
So,
yeah.
okay,
Sharing, partnership and collaboration.
right.
Mhm.
Loss of partnership and interdependence. There's a loss of mutuality, right? Some people talk about this role reversal, and I don't know what the heck they're talking about because I have yet to see people swap roles. I don't see this as a role reversal. It's role, there's a term for it. Role overload is the term that we use clinically. You're just doing too much. You're doing everything you used to do in the relationship plus everything they used to do in the relationship. And guess what? You're supposed to do it cheerfully. And you're supposed to do it in a way that lets them save face so they don't know you're doing it. And you're supposed to throw yourself on the sword. I mean, all those things are good, but how easy to do, huh? Not very.
I feel a loss of partnership.
So that's here, that loss of partnership, interdependence, and mutuality. Absolutely.
And knowing it's not going to get better.
Yeah, that's kind of that anticipatory grief, right? Waiting for the other shoe to fall. It's already this hard, and they tell me it's going to get worse. And that takes my breath away because I can hardly get through a day right now. What's that mean?
I think the pressure of the financial pressure that comes with it too,
Mm-hmm.
of being able to provide the best care.
Yeah, that's huge.
Yeah.
Financial pressure, cost of care, fixed incomes,
And they're not there to give their feedback,
Mhm.
where they've always been there before.
a compromised ability to gain income. And are you talking about, you said they're not there to give feedback like they used to. Are you talking about around the finances, managing? Yeah. So
You're on your own. making
Yeah,
choices
so
and
you have the
decisions.
pressure of decision-making alone, huh?
You try to explain it and it just doesn't get through.
Yeah. So this really touches all of these things, huh?
There's also the fear of what if I get ill?
Yes.
And not
Yes.
continue.
So that I hear fear, and I also hear some pressure in there. I better stay healthy. You know how many people I've heard say, I can't afford to get sick. I must stay healthy. So there's fear. And maintaining your caregiving role, huh?
Who would take over for me?
And when you don't
So-
feel good, you force yourself to do it anyway. You have no choice.
You take over my day activity.
So LTC, long-term care planning, that's difficult. A lot of times there aren't very many good options. Our choices are hard versus harder. The only good solution is our loved one doesn't need our care anymore because they were cured. That's the good solution. And that's not on the table. So we have to choose between multiple choices that are none of them ideal. You guys are a lot nicer than me. Do you ever have thoughts that are really stressful or situations that come up? Is anybody ever angry? Angry, impatient. So funny story, some of you have heard this before. One of my favorite psychoeducational classes that I used to teach when I worked at Redwood Caregiver Resource Center was an 8-week class. It was based in anger management, cognitive behavioral therapy. It was a curriculum out of Stanford that the Caregiver Resource Centers have. So when we first offered it, it was anger management for caregivers. Guess how many people signed up?
Everybody.
No, nobody signed up. And when we changed it, somebody else said frustrated. When we changed it to controlling frustrations, then everybody called.
No one wants to admit the anger.
No, exactly.
Why not?
You're not supposed to be angry.
You feel guilty about feeling angry.
Well, even beyond anger, sometimes you just want to be selfish. You just want to do something for yourself. And you lose that ability.
And I'm going to challenge the selfish, because I hear that as self-sustaining.
Oh, I agree.
So we have some shame ourselves. There's lots of overlap, as you mentioned, around self-sustaining desires and behaviors. Self-sustaining feels selfish. And again, I think that's part of that social information. Because while we are supposed to be independent and pull ourselves up by our bootstraps, we are also supposed to be ultimately altruistic and giving without question, without limits. And if we have any limits or needs of our own, then we're selfish. We live in a very black and white society, and most of life is gray area, which is what makes so much of this so difficult to navigate, because it's so gray and it's so complicated. So what's the guilt about?
You're not doing this, making it look easy, because you know inside yourself that it's so difficult.
So you should be more graceful as you're caregiving? Yes, you should.
Not doing it well enough.
Not graceful, not good enough,
Feeling responsible.
feeling responsible for fixing it and not being able to,
Well,
or feeling responsible?
I'm thinking if you have to be, how do you get to be self-sustaining if you have to ask someone else to give you a break? My feeling would be, but it's my responsibility, I shouldn't be asking for help.
So you're feeling guilty because you have limits. You shouldn't have limits.
No.
Okay. Here come the shoulds and the shouldn'ts, my favorite from
We should be a saint, right? That should.
shouldn't have. Anybody, and these are things that come up other times when I teach this class. Anybody ever have this thought? And if you don't, no big deal, but sometimes it comes up. Anybody have this thought? What business do I have feeling sorry for myself when after all they are the ones who are suffering? It's not like I have this disease.
Right,
Anybody have that feeling come up?
I can imagine.
So sometimes we don't think we have the right to our own needs. We don't feel worthy.
When is it my turn?
Yeah. When is it my turn?
Will it ever be?
Or will it ever be?
This is it.
Is this it? So there's grief around the loss of our hope. Somebody mentioned future, right? There's also grief around the hope of things getting better. Grief around the loss of those plans we had. This isn't what our golden retirement years were supposed to look like. This is not what we were saving for. We were saving for our cross-country motorhome trip. We were not saving for a skilled nursing facility or caregivers to come in and incontinence supplies. I heard someone say, I'm getting old. So some of this
Not
is,
fun.
oh, it's not fun getting old. No, it's not.
In my situation, it's a little different, because mine just happened overnight.
Mhm.
My husband had a TBI,
Mhm.
so our whole life just changed.
Just all at once, yeah. That can happen
So
sometimes
I
with,
dealt with that with my parents. but
Yeah,
My mother
yeah.
and father recently passed.
yeah.
But for my husband, it's the world.
You had to shift gears right away.
The world
Yeah.
changed immediately.
And it's different, and I don't know that there's a comparison of difficulty. I think it's difficult in different ways.
Different ways, but the same.
Uh-huh. These
But
things
the
all
same,
come up.
everything.
We're just presented with them in a different timeline. Yep. And depending on the timeline, that's difficult, right? So onset of illness or injury makes a difference.
So what's the magic answer?
Adjustment.
Do you have sadness out there somewhere?
I have grief, but I don't have sadness. And I think we need sadness. What's so sad? All of this is sad, isn't it? Yeah.
For me, I felt like my husband died the day that.
Yes. So
A long goodbye.
and I've had people grapple with feelings around this. I've worked with people who, they've had a traumatic brain injury or a stroke, or somebody whose husband had a massive heart attack and had a huge anoxic event because they weren't getting blood to their brain. And people crying in my office saying, I know this is horrible to say, but sometimes I wish he had just died. There's one of the videos that we watch on stroke in the beginning of the series where one of the wives says that. And then what do we do? What does that mean about us if we have those thoughts? Then we have guilt, right?
We have end-of-life decisions saying do not resuscitate. So
Uh-huh.
those would be the burdens of our children. things
Right,
like that.
right,
This is just,
right,
it's happening.
yeah,
And
yeah.
there's no choice end of life. It's just
right. It,
happening.
right.
It's not the end of life, and yet it is.
It's not the end of life, and yet it is. So these are all these blurry changes in roles.
Can I have one more thing?
Of course you can.
Fear, grief, or whatever about making a mistake.
Yeah, I got to do it the right way.
Well, just
Well,
not the wrong
what if-
decision.
Right,
I killed them.
Yeah.
right. So there's a burden, can I say burden of responsibility? Does that cover what you're meaning? There's a huge burden of responsibility. I always chuckle when I facilitate family meetings and the siblings are squabbling over why mom and dad picked you to be the agent and not me, because
Let's be there.
that's a really burdensome role to be in.
Exactly.
So I've been through it with my parents and my brother.
It's a really burdensome role. It's
I
really
don't know
hard.
which daughter I jumped to.
Mhm,
It's a,
mhm.
I-
It's hard.
It's a
It's really hard. So there's a burden of responsibility in all kinds of decision making. You talked about financial decision making alone, long-term care planning alone, end-of-life planning alone. How many people come through our office and the patient lacks capacity, so the decision maker has to fill out that post form for them. And even if you know the person's wishes, there's just something about being the person who fills it out, isn't there?
Yep. Make sure it's the right color.
Yeah, make sure it's the right color, bright
You learn
pink,
all
right?
the right things to do at the right time.
Nobody ever gets training for this, right?
Yeah.
No. It's kind of on the job, learn by fire training.
It works now or next week or tomorrow or 20 minutes from now, it doesn't.
Yeah. What about the peanut gallery? Is that stressful?
Yeah.
I didn't hear much about that today, but that comes up often. Family, friends, some, other healthcare professionals who don't get it because
And sometimes not having any.
they don't see it, and sometimes not having family, so no. I used to, I have people sometimes tell me, gosh, I wish I had siblings to help me with this. And I have other people saying, gosh, I wish I was an only child because the only thing harder than caring for my parents is dealing with my siblings. So, right, all of these things, we could keep going.
Criticism when they don't agree with
The
what you do.
criticism when they don't agree.
Or giving advice when you actually know,
Oh, advice.
yeah, like say, be patient, or really,
It's a judgment.
within 24 hours. you might do.
Just join in their reality, which is something I say, but we have to, it's hard to hear those things if it's coming from someone who doesn't really get what it requires of us to employ all of
They
these
don't know the
strategies.
whole picture.
So when we understand how complicated it is, when we look at this one, my hope is that you could be a little gentler with yourselves. My goodness, we could keep going, couldn't we? For time's sake, we won't. But hopefully visually you can see. These are all really valid. Does anybody disagree with anything we put on this? Does anybody disagree with any of this?
It's interesting to see the difference about receiving care versus what we are as caregivers giving care.
Oh, what's the main difference that you notice?
We're looking at ourselves more as giving the care, so we see it a whole bunch more.
Yeah, you're more in touch with this.
Exactly, we have
Right?
the experience.
Yeah, we're living it.
Yesterday, I came to your class yesterday, and you talked about the fact that caregivers, if you look at their health statistics, they're worse off. And right now, yes, we see the picture clearly because we're in it, but that page is a lot fuller.
Yes, that's what, just right off the bat, I noticed. And you know what I would say too, if you're caring for someone who has a cognitive impairment, then I think it's happening to you more than it's happening to them. You understand and they don't all the time. Even if they have that cruel awareness we talked about, they don't have it constantly. It's fleeting awareness. Even if they understand they have some memory problem or something's changed, they don't understand the scope of it. And they're not always aware of it, and you are. So when we are aware, I think the main themes that come up and the things, we could tie a lot of it back to grief, to anger. I think the guilt, and we could, but I think I think there's fear too. Did we put fear on this one? Thank you. And fear. And these are the main themes here too. If I feel like I'm a burden, I don't know if we put guilt here, but if I feel like a burden and I'm aware of it, then I might, do I?
So we're after anger?
Yay! So one of the things that I see happen really often for caregivers is this guilt resentment cycle. And some of you have heard me talk about this before. That I feel really angry or resentful because of all of these things. I didn't sign up for this. And then I feel guilty for feeling the anger or the resentment, because that must mean I'm selfish or uncaring or insensitive, only thinking of ourselves. And then I feel resentful for having to feel guilty because for goodness sakes, look at what I'm dealing with, and I put my life on the back burner for you, and I don't get to do anything I used to do anymore. And I still have to feel guilty about it? Then I feel resentful for the guilt and guilty for the resentment, and it goes back and forth. And I don't have any earth-shattering advice. I'll spare you advice. I don't have any earth-shattering advice around that one except for being aware of it. Because these are emotions. And emotions are not logical. They just are.
Sometimes learning to let go of reality. She greets that person in the mirror every morning and she's saying homeless. And I can't fight that battle.
Yeah.
Oh, okay, well, she's always nice.
Right, right.
Just do something.
So that's part of what you're saying. He's saying, sometimes you have to pick your battles. And I think that is one of the things that can help us with coping. And I think when we learn to pick our battles, we've gotten to the place where we're understanding the context. I spent a long time talking about how valuable it can be when we realize these are not people resisting our help because they are stubborn or resistant. It's because they lack insight for their need for help, and our help feels invasive. At the same time, if you were to say anything logically or reasonably to convince her that the person in the mirror was her own reflection, she may not believe you. So learning adaptive strategies and keeping the meaning that we assign to their behavior in the context of their diagnosis helps us set realistic expectations for them, but it also helps us set realistic expectations for ourselves. And when we're realistic with the expectation we put on ourselves, then we understand there is no right way. What works today might not work tomorrow, and it might work again next Thursday. And we understand that the best scientists in the world haven't come up with a cure for dementia yet. And so we don't have to put that burden on our own shoulders to help someone understand and remember going forward. Because if they could understand and remember going forward, guess what we just did? We cured dementia. And while it's sad that we can't do that, it's also liberating that we don't have to. We can just join with them. When we get to that place, it's simultaneously liberating and sad. We grieve the loss of the old relationship and the old way of relating. But we also get to unload the burden of the sense of responsibility for helping someone who's confused not be confused. That make sense? And that right there is an example of hard versus harder. I always say when I have easy, I'll teach that class. So another way, I'm going to get back to those emotions. Emotions are not logical, they just are. Emotions just come up. And so often what we do that makes them charge up stronger is try to push them away or try to analyze why we have them and justify whether or not it makes sense for us to feel this way or whether or not we are allowed to feel this way or that way. And that just kind of keeps our brain on them. It hooks into them. When we realize that emotions come and go, if you just took a journal throughout your day and just kind of journaled every little different emotion that came up, you would see they come and go. So when we notice we're feeling guilty, we can look at it. Oh, there's that guilt again. Did I hurt someone? No. Did I break the law? No. Did I do something totally egregious? No. Do I need to make amends for anything? No. Then I guess guilt might not be accurate here. I wonder if it might be better described as sadness. I feel so guilty that my mother ran out of money and could no longer afford to stay in her own home and pay for caregivers. And I don't have an extra room in my house, so I had to put her into this facility on Medi-Cal. And I just feel awful that I did that to her. I feel so guilty about that. Well, what were your options? Well, I didn't really have any options. I don't have the resources to care for her in my home. She doesn't have any resources. She can't stay at home without help. She wouldn't be safe. So I made the decision to move her to this facility with Medi-Cal, and I just feel so guilty about it. Versus, I feel so sad that my mom can't continue to afford care in her own home, and I don't have a better solution available than this nursing facility with Medi-Cal. I feel so sad that this is happening. Sadness is true. So sometimes it's helpful when we feel guilt, and I'm glad we have guilt. Guilt means we have a conscience. Guilt is like an alarm. Ding, 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 ding. Figure this one out. But just because we feel guilty doesn't mean we therefore are guilty. Does that make sense? And so often, the grief is so painful and the sadness is so painful, and we feel so powerless in our grief, because that's what grief does to us. That guilt buffers the grief. At least it could have been different. I'm not totally powerless here. This is so hard because I dropped the ball. That's kind of what guilt tells us. We're in this predicament because I blew it. Not we're in this predicament and I don't have any control over it and I can't change it. Now, I'm not saying that one's more comfortable. These are not good options. I'm saying that one's more accurate. And guilt buffers the grief and is a little bit more comfortable because it gives us this sense of control. We're not out of control. We had control. We just blew it, and that's why this is so hard. That's what guilt tells us. That kind of buffers the grief in the short term, but in the long term, that's where the resentment starts coming up. That resentment, that anger is self-protection. If we think about instinctive emotions, anger makes us instantly powerful when we feel vulnerable. So I think it's important to give ourselves permission to have these feelings because they make sense. I'm self-protective because I feel really powerless against a lot of this. My loved one's powerless, but so am I. I can't change the disease. I can't change what other people think. I can't, help scientists get a cure tomorrow. I don't have a lot of control here either. And so anger makes me more powerful too. So anger also buffers grief. Anger makes us instantly powerful when we feel vulnerable. So sometimes when we have a feeling of guilt come up and we're getting into that guilt resentment cycle, it can be helpful to say, is there something that better describes this? Is this entirely accurate? What evidence do I have to support that I am guilty just because I feel guilty? Does that make sense? So let's switch over and start watching the video and see if you can't hear any familiar echoes from this audience. My hope is that it will validate that you're not alone. Just sitting in this room should validate that for you. But also listen to some of the ideas that the social worker talks about. Now, she's talking to folks who are caring for people who both have cognitive impairments, and some folks are caring for people who don't have cognitive impairments. So sometimes she talks about having a boundary with this person or sitting down and having a talk with them and explaining how you feel, which would be a good thing to do if the person was clear thinking. Mm-hmm. If the person has dementia or a cognitive impairment, that's not necessarily going to be helpful. In fact, it could be counterproductive. But I would say you could still use the same strategy, just talk to yourself about it. What I need to have a boundary. Where's my boundary here? Not you need to respect this boundary for me. I get to have a boundary, here's my boundary. You have the conversation with yourself, not with the care receiver. Does that make sense? Might make a little more sense after we watch the film. Okay.